Hello and welcome to Healthcare IT Today. I'm Colin Hung and I am very excited to share this interview with you. While I was at the Health 2024 conference in Las Vegas, I saw a company in the exhibit hall that I do not normally see: Kroger Health. With the many recent high profile exits by retailers from the healthcare space, I was really curious to learn what Kroger is doing to remain in healthcare. James Kirby, the Chief Commercial Officer at Kroger, agreed to come on camera and tell us more about their efforts. Let's get to it.
Well, Jim, welcome to the program.
Thank you. It's great to be here.
I am super excited to talk to you because we do not see Kroger at a lot of the shows that we go to. So I'm excited to talk to you about what you're doing. But before we get there, can you just quickly for our audience introduce yourself and your role at Kroger?
Jim Kirby. I'm the Chief Commercial Officer for Kroger Health.
Jim, so talk to me about what Kroger is doing in the world of health, in the context of healthcare.
Well, I think this, as you can see here, is a perfect demonstration of what we're doing in the world of healthcare. For one, we're providing vaccines right there to any conference attendee, and we are showcasing our services that we have that sit at the intersection of food and health.
So I want to talk to you about that because we've heard a lot about food as medicine and these programs. What is Kroger doing in that space?
Well, we're very excited to announce here today at Health that we have a new relationship with BiteWell that's going to be powering a food scoring system where we're going to have over 90% of the items that we sell in our stores with a food health score that will simplify the nutrition facts panel down to a score of 0 to 100. And consumers can look at that and very easily tell, is this healthy? Is this healthy for me? And then we can aggregate that at a basket level or over the course of time and create an opt-up score. And we can demonstrate how that can lower healthcare utilization and overall total cost of care for payers.
So it sounds like you're really trying to make this very easy for someone to make the healthy choice, right? By using the scoring system as opposed to having to know that this food is better than that food from all the literature.
Yes, and then we can serve them up a better for you option that's not crazy. We're not going from cookies to kale chips, but can we have a healthier snack option for them? And we can present that to them. They can add it right to cart.
Amazing. And what are the other things you're doing with your clinics? Because, hey, let's be honest, we're seeing a lot of organizations close down their clinics. Kroger seems to be leaning more into it. Can you tell me more about that?
Well, we believe that we need to have accessible primary care services in the community where people are. COVID demonstrated that more so than anything, where everything was shutting down. And we got a lot of pressure to close our clinics during COVID. And we made the bold decision, be bold, that we were not going to close, that we needed to be open. And so that same sort of mantra holds true today, that we need to be there for our community.
And where else is Kroger going to be going with this? You just told me you were working with plans as employers. Who do you work with to really increase the utilization of all these services that you have?
Well, so I talked about the opt-up nutrition program powered by BiteWell's Food Health Score. What if that score also went to other providers? And that was part of the interoperable record. It was ported over as a health risk score. So now other providers could contextualize their opt-up score in relation to their blood sugar, their blood pressure, their weight. And so the conversation for physicians and health systems isn't just, hey, go eat more fruits and vegetables. Hey, walk around the block. That there's actually like a lab value, if you will, that they can use to help manage patients' chronic disease. So that's one thing. How do we, together with other providers, community-based providers or traditional healthcare providers, work together to improve outcomes and lower total cost?
And I got to ask this for an IT publication.
Sure.
Are you using, Jim, anything to make sure that the data that you're collecting can be shared easily with all the other members of this ecosystem?
Well, it first starts with, obviously, consumer consent. So we're working through a robust consent strategy to make sure that the consumers know what we're doing and that they're giving us permission to. But absolutely, if we're managing a patient in our pharmacies, our clinics, we're going to port that opt-up score over. And so then we can look at the medication profile, the gaps in care, the adherence rate, as well as what is their scores, their opportunities to improve their nutrition. And then how do we port that over into another EMR? But even pharmacists today that are providing care and are seeing patients for as some of those things for their diabetes or for closing gaps in care, we can create a continuity of care document and port that over to any EMR or any health system that wants to work with us.
Yeah, and we believe, I'm sure you do as well, pharmacists are a little bit underutilized, right?
They are.
And encouraging them to more practice at the top of their license to treat some of these common ailments that people come into.
Exactly. I think that now more than ever, it's a time to put competition aside And for traditional healthcare to look outside of themselves and say, how do we partner with community-based organizations, whether that be social organizations or community pharmacies, and power each other with the data that we individually have about the patient to improve outcomes.
Jim, you shared a lot of great information with us today. Where can people go to learn more about Kroger?
Go to Kroger.com or KrogerHealth.com and find out more. And I would actually encourage all of your community to attend the Nourishing Change Conference that we're hosting in May 13th through 15th, where we are bringing together other retailers, suppliers, health tech, to talk about the real conversations and real problems and solutions that we can collectively work on together. Not just admire or pontificate, but actually design solutions together to nourish the change that this country needs in health.
I love that. We'll put that link in the description below.
Perfect.
Thank you so much, Jim, for being on the program.
Thank you. It's great to be here.
I really want to thank Jim for coming on camera and talking about all the different work Kroger is doing to improve the health of the communities they serve. I really love their new food scoring approach. I think that will really make choosing the right foods a lot easier for people who may not be as up to speed on the nutritional values of things. I also think it's very prudent of them to really bolster their pharmacy-related services rather than try to replicate a clinic. And hey, if you enjoyed this interview, please mash that like button and maybe even subscribe. Also, head on over to healthcareittoday.com where you will find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.